Hey mamas, and welcome to the Entering Motherhood podcast. I'm your host, Sarah Marie Bilger, a wife, mom of two, VBAC mama, and doula. Join us every episode to learn from professionals, special guests, and moms just like you, ensuring that you know what you need to know and discover things that you didn't know before. I believe in you. Let's doula this, and let's navigate the transition of entering motherhood together. In this episode of Entering Motherhood, OBGYN Jessica Vernon discusses her journey into healthcare, her own postpartum struggles, and her unique collaborative work with midwives. She shares candid insights on the challenges of birth and postpartum. We discuss how important mental health support can be, and we also talk about the need for self-compassion and realistic expectations during this time in our lives. Jessica also talks about her book, Then Comes Baby, which aims to empower and prepare parents for the unpredictable realities of new parenthood, emphasizing on advocacy, community, and the value of holistic, patient-centered care. This episode will have you feeling more informed about patient-provider relationships, what you might expect along the journey of pregnancy, birth, and postpartum, and of course, Jessica's unique perspective and experience. So I know that you're going to get so much from this episode. And with that, let's get this episode started. Hello, and welcome to Entering Motherhood. I'm glad to get this conversation started. So how about before we jump into it, you introduce yourself for the listeners?
Hi, thank you so much for having me. I am Jessica Vernon. I'm an OBGYN in New York City. I do a lot of perinatal mental health care, very holistic in the care I provide, and work in a collaborative care practice with midwives. So get a lot of that holistic experience. I'm also a mother of two little girls, and I recently published my first book called Then Comes Baby, an honest conversation about birth, postpartum, and the complex transition to parenthood, to discuss all of the things that I talk to my patients about every day, about what they weren't expecting, what went differently or shocked them, and can lead to them feeling like failures or alone during this important transition. So that's a little bit about me and what I'm up to these days.
Awesome. So how old are your girls?
They are 3 and 7.
Great. And so you have been practicing as an OBGYN for longer than you have been a mother. What
Yes.
was that sort of like? Like, what interested you? Let's kind of go back, I guess. What interested you in going into that line of work? And then we'll slowly kind of trickle into how that shaped your motherhood experience.
Yeah. So I never thought I would go into obstetrics. I was looking at many different fields, but it hadn't crossed my mind that I would go into OBGYN. And then I did my rotation, and I was in South Texas when I did it. I went to school in San Antonio, but did my OB work down on the border where midwives pretty much ran labor and delivery, and the OBs would come in for operative deliveries, really. So I got to learn more about the art of labor and holding space and supporting people. And it was just so cool to see people going through this very vulnerable, very pivotal time in their lives, and how they felt during the process and after giving birth, and just being able to be there as a witness and supportive person for them during that time felt really amazing. And so it changed my whole focus, and I pivoted to going into OBGYN.
Wow. So do you feel like that is a unique perspective to have as far as going into OBGYN, having that midwife, relationship there from the start?
hmm Yeah, I think a lot of people train in very different practices, and there's so many different styles of medical schools and residencies. But now that I've been an attending in many different academic places that have residency programs and a resident myself, I've seen how a lot of focus for obstetricians is on the disease processes and what can go wrong, and also this like medical legal aspect and lens we have to carry in because of fear of something going wrong for the mom or the baby. And so practice can be very different than that feel that you get when you're just one-on-one with the midwife and they're just listening to the patient and listening to what their bodies are doing and really giving them a more holistic patient-centered lens in their care.
Yeah. So how long were you in San Antonio? And then when did you really zone in and focus on OBGYN as your practice?
So that was during medical school. I spent my third and fourth years actually on the border. It was through the medical school in San Antonio, but I went down to the border for the last 2 years of my training to have more direct patient contact than to be in a big academic center. And so I was down there a couple years. I did a few months between my initial rotation and some follow-up rotations in OBGYN once I decided to go into it. And then I moved back up north for the rest of my training.
So then you came to New York after that experience. What was the difference that you were seeing there, and how did you use what you had learned previously?
So I completed my residency first in Baltimore, and we also had midwives there. So it was a mix of OBGYNs and some midwives who helped train us, especially as interns in triage and also on the labor floor. But I trained in the whole breadth and depth of obstetric and gynecologic practices. And then I came to New York, where I've been for a little over a decade, and I've worked in practices in many places, in like City Hospital in the Bronx, in a big academic practice at NYU. Now I'm at another teaching hospital, but with a private practice, which is OBGYN midwife collaborative care. So the midwives provide the majority of the care, and I'm just there for consultation and support and backup if they need me, if something has to be escalated to the OB. So I'm kind of back to where I started, getting that lovely camaraderie and fellowship with the midwives.
Awesome. So you said over a decade ago, and then your children are 7 and 3. So
Mhm.
how was your experience professionally tied into when now you were choosing to enter motherhood, and what did that journey look like?
I decided to become a mother after I'd already been a practicing OBGYN for a few years. And I really had no idea how much that experience was going to shape my practice. There are so many things you go through, especially in the postpartum period, that I felt I had not been prepared for in my training. So many things I had not been taught to ask patients about or counsel them on or kind of delve into and create the space for them to really express how they were feeling. And also, there just really wasn't that focus on the time period between giving birth and the end of that first year, which postpartum is forever, really. But that first year is so pivotal. So much is going on mentally, physically, and emotionally. And I had such a difficult time with my own postpartum experience, with postpartum anxiety, depression, OCD that lasted a very long time before I even knew what was going on, that it really shocked me and made me change the focus of my practice completely to look more at the emotional aspect and get training myself in perinatal mental health so that I could support people throughout pregnancy and postpartum in a way that we're not routinely taught as OBGYNs.
Yeah. Yeah, I think there's so much to that, and I think it's great that you were able to have that personal experience and then want to shift how you were with your patients and how these parents were kind of coming into motherhood and what that was looking like. What kind of things specifically were you sort of shifting, or questions were you asking them to help with their mental health or just preparing for postpartum more?
Yeah, I think, and it starts even at the first prenatal visit, or if I see people for preconception, or if they're going through a miscarriage or fertility and then they get pregnant afterwards, is bringing all of that in and understanding their history and other things that are going to affect their mental health throughout pregnancy, like a history of trauma, whether obstetric or medical or sexual trauma in their past. And kind of acknowledging this from the very beginning, like this is probably there's going to be a lot of anxiety and stress, and there can be other things around this. So let's make sure you have the right support and resources from the very beginning to help you along this journey. And just acknowledging that and letting people kind of talk about their fears and anxieties and what's going on and how they're feeling and who they have surrounding them already to support them. And we go from there. And for a lot of people, the actual birth experience, being prepared for that, we see a lot on social media that shows us one way that birth goes and one way that we should experience it. And then if things go off course or if people don't feel that way about their process, then they can feel like their bodies failed them or they were failures, or there's just something wrong with them. There can also be a lot of trauma around the situation, even if like things went well, but they just didn't feel heard or they felt scared or like they weren't being supported in a good way. And so all of that then goes into the postpartum period, as well as these million other things that are going on with your massive hormonal shifts, brain changes, sleep deprivation, everything else that happens when you're bringing home a new baby while going through matrescence at the same time, which is a huge process for anybody, whether it's your first baby, your second baby, your third baby, you go through a new matrescence every time. And so it's a lot that we're not really taught about. And so to kind of create space for that in my visits with people and to tell them and prepare them to kind of listen to their own needs and create space for themselves during the postpartum period as well, because the mom is just as important as the baby, or the birth parent is just as important as the baby, is really important to kind of bring that up and counsel people on that and support them through that process.
Why do you feel like that is not something that's traditionally kind of taught in OBGYN, even midwifery? Sometimes it's not, included to be discussed, or sometimes it's overlooked, or there isn't that personal experience that people are having and bringing into the picture.
Yeah, I think there's a lot of reasons. It's really hard, first of all, the way our medical system is set up, that you often have very short visits with your provider. And in traditional practice models, a provider might have a patient booked every 15 minutes. And so if they ask the questions, if they sit there and give someone time and space to talk, they're never going to get through their day. And so often it's very quick in and out. There's also, because there's a lack of training and like things around mental and emotional support, a lot of providers don't have the comfort and knowledge to delve into that. So if someone says they're struggling, even without asking, if someone actually feels empowered and feels comfortable, even with all that stigma, to say, like, I'm really struggling here, this is what's going on, they often don't know how to respond, where to send them to get the right support they need. And so having these conversations can be really hard. But there's also a lot of things that we see on social media and in society. And the narrative is that like pregnancy and birth and postpartum is this like beautiful time, and we should just be so happy and grateful and fall in love with our babies immediately. And that's just not the reality. And so when people experience feelings that are different than that, they often feel this like stigma and shame, and that maybe there's something wrong with me. Maybe I'm not meant to be a parent. Why is it so easy for everyone else? Why am I not enjoying this? And a lot of it is teaching people that that's okay. And you can have a lot of conflicting emotions, but it doesn't have to be this or that. It can be both. And embracing all of like the messiness and everything that comes along with becoming a parent is something that we're not good at. But I also think in our society, like, we don't provide support for people during this time period. And so if we were to say, this is really hard, we need to give new parents support, then that means everything has to change in the infrastructure of society. And there are people working towards that and proponents of that. But as we know, like women's work at home and all of this, like even caring for the baby while you're pregnant, that is not really valued in our society. And so it's easier to say like, oh, this is just natural and easy. And, everyone loves being pregnant and having babies. And then saying, this is really hard and you need to be surrounded by a village and you need time off of work and you need free childcare and all of these things that could actually support someone so they weren't struggling during this time period.
What do you think personally was happening in your motherhood experience that led to harder postpartum? And you were saying
Mhm.
more anxiety, OCD, things like that.
I mean, I was a setup. One of the biggest risk factors is a history of anxiety or depression, and I definitely had those at different points in my life. I also had like premenstrual dysphoric disorder, which is another hormonal change that happens to our bodies. So when you're sensitive to hormonal shifts, you're going to be sensitive postpartum. You're also going to be sensitive when you go into menopause. So, I'm always telling people to watch out for down the road. And being a constant caregiver and nurturer and someone who was really trained throughout my career, like in residency, we're taught to kind of function like robots and be proud of the fact that we can go with very little sleep nonstop, make sure everything is done before we're signing out to our next colleague. And so becoming a mother, I tried to replicate that and not ask for help, to try to do everything myself around the house and for the baby, and just neglected myself completely. And that really set me up for failure. And it set me up for just being completely depleted. And so mentally, my brain was going haywire with all of these thoughts of like, you need to get this done and this done. And what if this happens to the baby? And all of those intrusive thoughts that then can lead to OCD and like avoiding things or other repetitive behaviors. And I wasn't telling anyone about it because I just thought that was like normal for a hypervigilant new mom. So there were just so many things that I didn't know to look out for, but I also didn't know like these are very common and they're treatable and you can get help. And I felt like I was not a good parent if I needed that help, if I needed that support, which I hear from new moms all the time. They're like, my partner went back to work, so I'm doing all of the nights. I feel guilty getting help during the day because I'm not working. So, like, what I'm doing to take care of the family and the household, that has no monetary value. So, I am not providing any value. I need to do everything myself. A lot of that, like, I had to shift that mindset for myself. And now I do a lot of that, like, shifting for my patients as well.
How did that differ between your first and your second?
Oh, it was such a different experience. If I hadn't gotten well after my first, and they're 4 years apart, I took some time. I never would have been able to have a second. And so I did a lot of therapy and work on myself. I got on medication. I made sure that I had time in my schedule to focus on me, which I know is a luxury. Like a lot of people don't have the time to be able to like see a therapist and go to the gym and do other, acupuncture, other things to really focus on their well-being as much. But I was lucky that I was able to do those things. I also hired a babysitter after my second one to come at night so that I could get some sleep at night, which is so important for your mental health, and why like partners, other support people, family members, you really need to like get them involved in doing some of the night shift and some time during the day so you can nap as well postpartum. And then I was just prepared to say good enough is good enough, and not everything's going to be this ideal perfect version of what I think it should be or what's worthy of going on Instagram. And so I just, if the house is messy and I'm taking a shower, then that's okay. I'm not going to sacrifice myself for other things that aren't as important.
And then when did the thought of having your book come in all of this process, and what was that like?
Yeah, that started before I had my second baby, and my goal was to like submit a book proposal before I had her. And and so during that time after I was feeling better and when I was starting on that journey towards having a second child, I had also really shifted my practice to doing a lot of perinatal mental health, and even my patients who I was seeing for routine prenatal and postpartum care. I was talking to them about these things. And so I kept hearing the same things over and over that were causing people to struggle and just feel completely alone. And I knew that feeling of like looking at all the other moms around you and seeing like, why does it seem so much easier for everyone? Or why does their birth experience, their experience with breastfeeding, all of these other things seem so different than me? And so after hearing these things over and over, I was like, let me talk about these common things that people have questions about that they don't understand, that no one even told them about. So they're so shocked, and hopefully help other people feel more prepared and empowered going into their own birth and postpartum, and also less alone in like a failure if something doesn't go as they planned for and expected. Because ultimately, the scary thing about pregnancy and birth is that you can prepare and plan as much as you want, but you can't determine how things are going to go. And so being okay with that uncertainty is really hard. And it's something that we have to kind of learn to be okay with, and building in some grace for ourselves and the whole process and how our bodies work through labor and birth and how breastfeeding goes and everything is just so important to kind of like healing and treating yourself with grace.
What was your birth experience like for both of your births?
My first, I was in early labor for a very long time, never got into active labor. I had two big babies. My first one, she was facing sunny side up and she just never came down. And after a long labor, I had a C-section, which I never thought would happen because I came from a family where everyone had vaginal births. You can't tell on a podcast, but I'm like 5'10". So typically, like taller women also have more space to get these babies out. And so I was kind of surprised. I wasn't as upset or traumatized by it, I think, because I've seen it happen so many times. And then postpartum, it's like C-section is just a C-section. And everyone's like, it's the most common surgery. But when you have a C-section, it's major abdominal surgery. And so I think the bigger issue for me was postpartum trying to like jump up immediately and try to run around and do everything and not realize like you just had surgery and you're sleep deprived and you're producing breast milk now. Like you need to chill out. So it was more like my postpartum, I think, that was the bigger thing. And then my second, I had a repeat C-section. And that's like a big thing that people talk about. Like, do you do a TOLAC and try for a vaginal birth? Do you have a repeat C-section? For me, I was like 40. I was having another big baby and I just didn't want to go through it all again. So I chose a C-section, but you definitely see like judgment on both sides, because when I was talking about maybe doing a toe, like I had colleagues who were like, are you crazy? And when I was like, I'm going to do a C-section, I'd like some of my like friends who are like labor and delivery nurses were like, oh, they were so like disappointed because they're like, we want to support you and be there for you for your TOLAC. And I'm like, sorry, guys, not going to happen. So yeah, but my second experience was much better in a lot of ways because I also took the time to like heal and rest. And I knew what my postpartum body was going to look like, which is a big shock after the first time when you're like this, like the body dysmorphia of like, who am I? Who is this person in the mirror? I look completely different. That I was prepared for as well. So wouldn't say I didn't have bad birth experiences. For me, it was more my postpartum journeys. But to be fair, I also had providers both time that like I knew my OBs very well. I trusted them. I also had the medical knowledge to like say, okay, like this is the right time to go for a C-section. And so it was very different than for a lot of people who just feel very alone and not seen and heard and have a lot of distrust with the medical system for many reasons. So I feel I was very lucky in that regard.
Yeah, I definitely think it makes a difference, knowing and even on a personal level too, and knowing what to expect and what the OR is going to be like and things like that. So even though it wasn't a planned cesarean for your first, you knew kind of going into it what that procedure was going to
Mm-hmm.
be like. Even though you didn't personally
Mm-hmm.
go through it before, you did have that hindsight of being on the other side of it and knowing that experience.
Yeah. And these are things like my book starts talking about birth plans and what it's like in like spontaneous labor, a labor induction, a C-section. And I tell people, like, before they go into the OR, I'm like, the OR is going to seem scary if you've never been in. There's bright lights. There's a lot of people running around. They have masks on. We're doing so many things to you at once. And so even like my bedside manner in the OR has changed a lot. And like saying, when you get the epidural or the spinal, this is what it's going to feel like. And you're going to feel like you can't breathe. But if you're talking to me, it means that you're breathing. So like these little things that before you go through it yourself, you don't realize. And we can also get in like the routine and the hustle and bustle of like, I've been involved in thousands of births, C-sections, vaginal births. And so when you're doing so many a day or a week or whatever, it becomes routine. But for that person, that's their only experience or maybe one of a few experiences. And so it's so important to like take it from that approach and be like, this is the birth of their baby. And it might be the only time they go through it. They might have had a terrible experience last time, or we want to make sure this is a good experience so they're not like traumatized and say, I never want to have another kid because of this. So I think that really shifted for me as well, going through everything.
Yeah, my first actually resulted in a cesarean as well. Same sort of situation, very long labor, sunny side up, wasn't coming down. And so I had gone in for the cesarean, and right immediately when they had cut me open, she started like crying because her face was presenting in that direction. And the
Oh my
OB,
gosh.
I just remember saying like, oh, that's like unusual, or that's a first, or something along those lines. And I had not the clear drape, just, I couldn't see anything. And I hear my baby crying and the OB saying that. And I'm like, what's not supposed to happen? Or what's happening? Like,
Exactly.
it's like, a unique experience for them, and they're just like, "Oh, this is cool. Like, I've never seen that before." But you just hear your baby crying and then hear that kind of language, and it's such a disconnect of like, "Okay, can you explain to me like what's going on?" And then I was
Right.
having like such an emotional reaction, like when she finally was able to come near me, and I was kind of like laughing and crying like all at the same time. And I remember them
Yeah.
saying like, "Hey, what is going on?" Like, I didn't know if they thought I was like seizing up or what, because your abdomen is still kind of, moving even though you're numb, and I'm laughing and crying and having all this, and they're like, "Hey, you need to stop." And it's just like, I get that like they're trying to do their job, but it's also, like you said, like I'm going through this like very personal first experience. And it helps so much when they have that conversation with you and they explain like, okay, this is what's happening now. Okay, like this is what's occurring. It makes such a difference, because when you are going through it for the first time, even if like you read all the books or listened to all the podcasts or did all of the
Yeah.
birth classes, you still don't know what
Yeah.
exactly is going to happen.
Yeah, and it also is such a unique surgery because you are wide awake and you're very attuned to everything that's going on and listening to what they're saying because they're delivering your baby. And so you want to know what's happening. And so I think that's really important too. Is so many people will hear their providers talking and saying things, a lot of things like completely unrelated to what's going on in that room. Or they'll be like, I could hear the doctor teaching the resident the whole time. And like, are they practicing on me? What's going on here? Like so many things that you have to be really cognizant of in a C-section that is different than other surgeries.
Yeah. What would be one thing that you would really want new parents to know when they're coming into this and bringing a baby into the world?
Yeah, I would say that no matter what you're thinking or feeling or experiencing, you are not alone. And so it's so important to find your community, find your people, find your support, whether that's like family, friends, in person. There's so many virtual support groups you can join because it feels so much lonelier if you feel like you can't relate to anybody. So find your people through this experience and try to leave some room to like be surprised along the way, whether it's good or bad, and know that none of it is your fault if anything goes off course. There's just uncertainty in this. And treat yourself with grace and love. And no matter what happens, like you're growing and birthing and caring for a new human. And that's huge. So, respect yourself for that.
Awesome. Is there anything else that you would like to add to wrap up this episode and conversation that you feel like, maybe is something that we haven't talked about?
On a patient advocacy level, just if you feel uncomfortable with your provider or your care team, find someone that you can bring with you to help you speak up, or find another provider. Don't ever feel like you have to go through with something without having all your questions answered and being comfortable with the plan, because this is like your one of few birth experiences. And so you deserve to feel taken care of in one of those most like vulnerable times of your life.
Where can we reach you, get in contact with you, find the book? Tell us all the details.
Yeah, the book is available now at all major places you buy your book. The audiobook is also coming out soon, which is good for, busy people who are pregnant. And you can also find me on Instagram and my website, Dr. Jessica Vernon.
Awesome. Well, thank you so much for coming on and sharing, your personal experience and your professional experience and how that all has tied in together.
Thank you so much for having me.
Thank you, mamas, so much for listening. Remember, you are a rock star. I believe in you. Let's doula this. Let's crank it up a notch and let's kick it into high gear together. Hit that subscribe button. Share this episode with a friend. Message me, email me, call me, beat me. You know how to reach me. We're doing this, mamas. I am so excited to catch you here next week. This is your one-stop go-to place for helping you find the resources you need to make the best choices for you and your family during pregnancy, birth, and most importantly, postpartum. See you later, mamas.